Hi everybody, Dr. Jonathan Zelkin here, a board-certified plastic surgeon out of Newport Beach, not Irvine, California, and I'll tell you why I say that. I found out a couple days ago, believe it or not, through a patient, that Chrissy Teigen, a famous model, had buccal fat pad removal. And then out of curiosity, my Google alerts sort of let me know that I was mentioned in a few press releases and news articles, and my website was actually cited in terms of discussing some of the nuances of this operation. And so I went and did a little bit of background research, and I read about her operation. And so I guess last week or within the past few weeks, model and actress Chrissy Teigen had buccal fat pad removal with Jason Diamond, a really good plastic surgeon in Beverly Hills, California. And she's really happy with her result. Normally I don't think I would cover this topic because I've sort of covered a lot of topics relating to buccal fat pad removal and facial slimming. But this one is a little bit more interesting to me because I'm not sure I agree that she was the best candidate for the procedure. And so I feel that it's an important discussion point. People often ask me, am I a candidate for buccal fat pad removal? And I'm going to give you a few reasons why I think she may have benefited from other procedures instead of buccal fat pad removal. So this is a pre-op picture. I think I just Googled her, maybe a year ago or something like that. This is an older photograph of the model Chrissy Teigen. It's important to notice a few things. Number one, she has some Asian ethnicity. I think her mother is from Thailand. Number two, she's struggled with weight issues over the past 20 years. And she's been sort of condemned and criticized for weight loss and rapid weight change and other things like that. And number three, she has a lot of pressure to be relevant and beautiful, of course. So she went and she said, I have fullness in my face, I'm just assuming, and I want an operation to slim my face. So buccal fat pad removal is a beautiful operation for this. It's really catered to a lot of people who want that model-esque sculpted mid-facial appearance. And if you look at this picture, she has it. And this is before surgery. She absolutely has it. So I almost can't think of a better example of full cheeks and a nice strong jawline with a mid-facial concavity than hers. You can see it on the oblique view very nicely, and I think that this patient absolutely does not need buccal fat pad removal because she has what people seek this procedure for. Now, here's another concern. This is a patient who is trying to find ways to make her face look more slender, and I think this is part, in many cases, and I'm not trying to make this an ethnocentric discussion, but of Asian faces in particular, where the facial skeleton happens to have stronger, more defined cheekbones. And there is a desire to look slimmer that you can't really achieve with weight loss and diet and exercise alone. And so operative tricks like a V-line jaw or buccal fat pad removal are very popular amongst my own patients who fall into that category. And so it makes sense that she would want a procedure like this to look more slim, but I don't think that that's the procedure that's going to do it. In fact, I would expect, and it has based on some videos I've seen, it would actually accentuate her cheekbones and jawline more and make her face just as wide. So buccal fat pad removal doesn't make your face more narrow. Reduction of the jaw or Botox to the masseter, for example, will do something like that. If you're looking at the lower face and jawline, a lot of these articles and press releases says that this procedure is designed to enhance the jawline, and it really doesn't. It doesn't have anything to do with the jawline. But liposuction and slimming of this jowl area would, and the perioral mounds would. So I think the patient, or Chrissy in this case, chose a good, dependable operation, and most importantly, she's really happy, and she's identified this on her own social media outlets.
I did that Dr. Diamond buccal fat removal thing here, and since I quit drinking, I'm really seeing the results, and I like it. Yeah, I did it once.
That this is a great operation, she's happy with it, and honestly, that's the most important thing of all. If she were my patient, I may have recommended slimming of the jawline with liposuction and skin tightening. I may have recommended perioral mound reduction. I may have recommended Botox to the masseters, and I'm sure she's tried all of these things. She may have thought about trying these things. She's beautiful either way. She's got obviously a very strong following. She's obviously a famous model for a reason. I just wanted to give my 5 cents on this topic because I don't think she was the best candidate for buccal fat pad removal. I want you guys to weigh in on this topic. I am trying to be as balanced as possible. I think the surgeon that she chose did a fantastic job, and I think you guys can decide for yourself if she is the best candidate for buccal fat pad removal based on everything that I've talked about in the past. Thanks so much for watching. Bye.